The U.S. Agency for International Development has been working in the Democratic Republic of Congo since the 1960s. The installation of an elected government in 2007 has presented the greatest opportunity since independence for a stable, representative democracy. However, life expectancy in the DRC is only 46 years, and nearly 83% of all Congolese have either only primary schooling or no schooling at all. USAID programs seek to promote the country's emergence as a coherent entity that serves all Congolese. The Eastern Congo Initiative supports Congolese organizations through direct grants to support local solutions to local problems. ECI works with communities to provide counseling, healthcare, and legal support to survivors of sexual violence, to return and reintegrate former child soldiers into their communities, and to support community-level peace and reconciliation processes.
Ben, many people look at the Congo and only see violence, but you've seen hundreds of people in dozens of local organizations doing amazing work. Why do you think it's critical to partner with community-based organizations?
Well, I think, if you stop and think about it, it only makes sense that people who grew up in a community, who live there, who have family there, who have extended networks there, would know how to work there better than those who come from somewhere else. I have said before, it's as if the Chinese showed up in Iowa and said, well, this is how you're going to farm. Those farming techniques might be good in China, but you're going to have, they don't speak Chinese, and they don't, and the Chinese people don't know who to talk to. I mean, it would be absurd. There are big NGOs that I think do very good work, but when I did research around Congo and other countries, what I found was that the people doing the best work with the real expertise, who understood what was needed intuitively, just like they would in my neighborhood, who knew who the guy was to talk to, were community-based organizations.
In 2010, USAID embarked on an ambitious reform agenda to change the way the U.S. government partners with local communities. In 2011, it partnered with ECI to undertake a landscape analysis of community-based organizations in the east of the country. The Eastern Congo Initiative is one of many organizations that is working to support CBOs and provide services directly to their community.
Eastern Congo Initiative, a tireless partner in this effort, is supporting civil society groups to meet some of the biggest challenges in that country.
In 2010, in partnership with USAID, ECI deployed researchers to Maniema, North Kivu, Orientale, and South Kivu provinces to identify and assess Congolese community-based organizations. Researchers interviewed representatives from 292 organizations and visited 63 towns. Findings show that the way forward is in the hands of the Congolese.
For the past 6 years, I've had the great pleasure to visit Congo many, many times. The potential for change is abundant. We're pleased to announce the completion of an online searchable database of community-based organizations doing important and impactful work in Eastern Congo. This rigorous landscape analysis, developed in collaboration with USAID, identifies Congolese-led organizations that are improving outcomes in their communities. We believe that our role is to support the Congolese and support community-based organizations.
One of these CBOs is Panzi Hospital. The hospital is located in Panzi commune, about 8 kilometers from the center of Bukavu in South Kivu province. Officially founded by Dr. Denis Mukwege in 1999 with international donor support, today it is renowned for its treatment of survivors of sexual violence and women suffering from severe gynecological conditions. Dr. Mukwege has been the recipient of numerous awards in recognition of his work at Panzi Hospital and has been nominated for the Nobel Peace Prize.
Now, you have founded an amazing organization, and particularly around repairing gender-based violence that has been so pervasive. Tell me what some of the hardest challenges have been for you, and what's it going to take to really have your kind of innovations be able to serve more people in the East?
I think that in the East now, the hospital that I'm running, the Panzi Hospital, when we started 12 years ago, just I saw one thing was really special. that I saw that many women who were coming to the hospital came with some kind of wound were really abnormal wounds. And we start to treat them, but there is one thing that I can say that we saw at the same time is we saw a big number of fistula, obstetrical, also fistula, obstetrical. And today, my vision is that this fistula, obstetrical fistula, can be prevented. We can prevent this kind of handicap for women. And I think that for many women who are living with this kind of handicap, it's a terrible life. And today, we are now out of the hospital because now our challenge is to try really to prevent, not only to prevent, but also to show women that this handicap can be treated. Big organizations are doing really good job, but the problem is that when they are not working with the local community, they will get time to live, and when they leave, nothing will stay on place. So all things will be destroyed. But when we work with the local community, when we teach them, when we build capacity of the local community, even if there is no money, the population can continue to do it themselves.
Heal Africa is another notable CBO in the Democratic Republic of Congo. Founded over a decade ago during the peak of the conflict by Congolese orthopedic surgeon Dr. Joe Lucy and his social activist wife, Lynn, Heal Africa partners proactively with communities in the DRC to transform the status of women and bring village life back into balance. Today, Heal Africa helps support a Congolese staff of 28 doctors, 54 nurses, more than 340 community development advocates and educators, a small administrative team, and hundreds of Congolese volunteers.
Dr. Lucy, you founded an amazing organization, Heal Africa. Tell us about the kinds of changes that your organization has been pioneering in the Congo.
We came there when everything was destroyed, and all the doctors have been leaving the country because of the total destruction and going back to South Africa or to countries that can give salaries. And we find ourselves there in a country with a vacuum, the absence of a government. So we said, okay, what can we do as natives of this country? We said, we have to, when there is a great need, you have to do something at least to teach some doctors. And then we saw that during the war, it was the ladies, the wives, that have paid the highest price. Because you will see their wives being raped, and the wives were, as you said, there was no road. 80% of people were living in rural areas, and the majority of people being the ladies who goes to collect woods, and they will deliver in a village, into the bush, and there was nobody to help them, no birth attendant, so they will try to deliver alone. So we said, okay, we have to try to do something to help them and to teach young doctors how truly to take a responsibility of trying to do. So we said, what will we do? We are lacking medical care, we are lacking action, education, and we are lacking action in the community. Actually, we are lacking leadership. This corresponds to the English word heal. So let's say Heal Africa means health, education, action in the community, and then leadership. And when you tackle those three things, then you will really have healed holistically the wives, the community, and then the country, and even an individual ladies. If you want your country to develop, put all your money into the education, the healing, and the action of ladies.
Yeah.
And we believe there are people on the ground who are Congolese who are worth supporting. And that was borne out by this landscape analysis. And these are sustainable solutions. They cost a lot less money than what larger NGOs spend, and they're done in a caring way because it's their family, it's their neighbors, it's their brothers and sisters. And in a conflict zone with people who, many of whom are living in extreme poverty and some who are just living in poverty, and you're gonna have difficulties. And what's remarkable to me is that in the face of these difficulties, people who live there are stepping up and saying, I'm not waiting for anybody else. I'm not looking for someone else to come tell me what to do. I'm gonna do it. They're taking the initiative. I was so moved by that I said, that's who I wanna help.